Tracy, I just sent you the link.
Okay. Looking forward to something. What is this? Good. Let me go verify that it's up and working. Okay, we're good to go.
Thank you.
You're welcome.
Good
All right,
morning, everyone.
Good morning, Darby. You are live on YouTube. You're good to start your meeting.
Okay, have the new members been sworn in, or do we need to do that before the meeting or
They've been
after the meeting
sworn,
starts?
they have been sworn in, ma'am.
Thank you.
And
Okay.
also, so you know, Darby, you have Kristen from AOTA, and also Julia is also just coming in now as well, because they're the ones who
Awesome.
you're good to start.
Okay, great. Good morning, everyone. Okay, a meeting of the Louisiana State Board of Medical Examiners Occupational Therapy Advisory Committee pursuant to lawful notice is duly convened and called to order at 10:09 Friday, November 17th, 2023 via Zoom virtual video. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Dr. Van, can you please confirm that you have verified the identity of all the tele and video conference participants?
Yes, ma'am, we have.
Thank you. Is the sound clear and audible to the public and those who are on tele and video conference?
Yes, ma'am, it is.
Great. Just quickly to review, the mission of OTAC is to ultimately to protect the public, that is the consumers of occupational therapy, by regulating competent practice and upholding the standards set forth by the governing rules and regulations. We're going to try to go through the members that are here. Darby, elevator. Chair. We have Ingrid Frank, co-chair. Brenda Martin's here. Kelly Brandon is not here yet, right? Carolyn Murphy is not able to come today. We have Raylina. I saw her here. Yep. Kimberly Solari is currently updating her Zoom. Amy's here. And Glenn Wallace is running late, but said he would come. We also have our new members that we would like
Glenn
to.
is on.
Sorry?
Glenn is on.
Oh, and Glenn is here. Thanks. We have our new members. We have Kathleen Norcross. Welcome. And we also have Mary Green Keys. Welcome. Okay. And then I see Tracy's here from IT. We have Olivia Jacinta with us today. Patricia Wilton. Tracy. I don't see Sandra for licensing analysis. We also have a special guest from AOTA, Kristen Neville. She's the AOTA Manager of State Affairs. Thank her for coming. And Ingrid, can you please confirm that we have a quorum?
Sorry about that. Yes, we do have a quorum.
Okay.
And
great.
Darby, do you mind if I introduce you to our newest board attorney, Lauren Suddeth? She is joining us from the Attorney General's office. We are thrilled to have her here. And this is our first OTAC meeting, so please, we're happy to have her, and she's gonna eventually transition to being the point person for some of the advisory committees. We haven't really divided that up between ourselves yet, but she's sitting in today.
Great.
Well,
Nice to
Welcome.
meet you.
Hi, Lauren. Thank you for being here. Okay, great. So we have a quorum. All right. So I was just going to kind of, oh, and we also have Julia Cahill. I'm sorry, Julia. I see that you're here. Just to get started, I thought we would approve the minutes, and then we will talk about the OT and coaching role, and then move into executive session. And that way we can have Julia and Kristen their items first, and then they can go if they would like. Okay, so if you're on the cloud share, or if you've had time to access the minutes from the October 13th meeting, someone would like to make a motion for to approve the minutes, unless you have any changes.
I'll make a motion to approve. This is Brenda.
Thank you, Brenda.
Kim will second.
Who was that seconded?
Kim.
Kim, thank you.
All right, thank you, guys. Okay, all in favor? Please say aye.
Aye.
Anyone opposed? And Dr. Van, can you please check to see if there's any public comment? Dr. Van, Olivia, can y'all please check if there's any public comment?
At the present time, there is no public comment, ma'am.
Great, thank you. And guys, just some housekeeping. Mary and Kathleen are, just so y'all know, because Brenda and I are still at the meeting, y'all are not able to vote. So I just wanted to remind you of that. But you are welcome to comment at any time. Okay, so we have two guests here. We have Julia Cahill and we have Kristen Neville from
Dr. Cloud, if you would like to share your screen, you are able to.
I'm sorry, who's that, Ingrid?
That's just in case you want to look at the minutes of the agenda. I'll share it whenever you all need it.
Oh, okay, thank you. Maybe if y'all could pull up the email from Julia, just so we can make sure everybody's on the same page before our discussion. So Julia, just so you know, I had forwarded the email to, the email was forwarded to the committee for discussion. And then I also forwarded it to Kristen Neville, who has been a great resource for us. She's the manager of state affairs from AOTA, just to open up the discussion, to make sure we have any questions. And we're very thankful that you're here so we can get some clarification.
Can you all read this one?
Yes, sir.
Okay.
Okay. So Julia, would you like to give us some background, or do you want me to read the email?
Can you hear me? You guys hear me okay?
I'm sorry, I can't hear you.
Can you hear me at all?
Yep.
Okay, there we go. No, so I am obviously an OT. I'm currently in the process of creating something along the lines of a health coach business. And I'm trying to figure out where I need to draw the line between OT practice and the coaching practice. I want to make sure I'm not stepping over any boundaries. A lot of what OT does is generalized, that's where I'm having a hard time distinguishing. Obviously, what am I allowed to do? I can what is it, PDT and ADA. I know I can't include anything like that, but just in general, is there anything you guys recommend that I need to do? Like, hey, disclaimer, this is not an OT session. There's no eval, there's no insurance, there's no notes, there's anything else that you guys might find that you would want me to have disclaimed out.
Dr. Van, did you want to start with any questions or comments, or should we start with?
I think you all should discuss this and get your input from Kristen, and then we'll all talk about it. But at this point, I'm listening, trying to figure out how it fits into the rules.
Okay.
Question, I guess, for Julia. This is my name's Ingrid Frank, also an OT. I guess it feels sort of gray, Julia, in the sense that you might not be laying your hands on a patient, but a lot of OT intervention is education, talking to a person about how they can adapt either their body or their environment in order to reduce pain, and that is OT, and that is OT service provision. And I guess I'm just wondering why not just call it OT and get a license to practice in various states in order to cross state lines?
So what I'm trying to do is videos in video, like something they can kind of follow along with on their own. So I don't know where these patients would be coming from. A lot of the stuff that I intend to provide is generalized. So that's where I'm kind of trying to figure out where all the brain needs to OT light.
It's really hard to understand you. You said what you're trying to do is virtual intervention?
Virtual intervention and a lot of pre-recorded video.
Pre-recorded, I see. So a lot of pre-recorded videos that somebody would watch. And then what would be the follow-up after that, I guess?
The follow-up after that would be virtual if they needed it or requested it.
And what do you envision as the content of the pre-recorded videos? Like, is it educational? Is it like I'm just kind of curious.
A lot of the content that I've come across so far that I want to teach is a lot of, I call them aha moments, like identifying the triggers to the pain and all that stuff. But a lot of that is self-reflection on the client.
Does anybody else on OTAC have any questions or want any other clarification from Julia?
I guess one of my other questions is like, are you getting sort of training or a license as a coach?
Currently, coaching, from what I've found, does not require a license. There is a certification that I can get that I'll probably pursue very soon. I'm still in the initial stages of everything.
Darby, do you mind if I ask a question?
Not at all. Please, Patricia.
Hi, my name is Patricia Wilton. I'm one of the attorneys that works for the board, and forgive me if I have a layperson's perspective and I'm not completely understanding. Are you talking about, in the most colloquial of terms, let's say, are you talking about the equivalent and I don't mean to diminish it in any way, but are you talking about the equivalent of a YouTube video where somebody says, gee, I'm an OT and I wonder how people do this thing or approach this technique, and your videos would show them that in a generalized manner? Or are you talking about a specific one-to-one relationship with an individual practitioner in the state of Louisiana where you would consult with them about their specific patients?
No, this would, in the sense where the pre-recorded videos, I don't intend to put up on YouTube. It would be something that they would get from a separate site that I would put up eventually. The I wouldn't be working with any practitioners, kind of as a consultant, I guess, if that's what you're asking.
Yeah, can you say that again? I think you answered my question, but it was a little garbled.
Okay. Okay. Sorry. I'm also in a place with bad service. No, this would be the videos themselves. The intent with that is that it is self-paced for the client to do on their own. It's a lot of self-reflection. The next step beyond that would be groups or individuals or yada, 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 where it's still a lot more coaching based and open-ended questions. And a lot more same thing. They're coming to the conclusion to do energy conservation stuff or figure out their own way to modify their own path. A lot of it is that education piece where they can learn. Yeah.
Yeah, and so just to give you an analogy that might make sense, from my perspective, like I can't give legal advice to anyone with whom I don't have an attorney-client relationship. On the other hand, I could have a website that says, these are blog posts about various topics of interest generally in the field of law or in my field of specialty or whatever. It would have disclaimers all over it that said, this is not legal advice. You don't rely on this. This is informational or generalized information only and does not represent any recommendations, practice, what I'm saying. So that's the sort of the dividing line that I as the lawyer would be wanting to clarify, that nobody would be calling you to say, I'm going to pay you whatever your fee is, and I'm going to tell you about patient X that I have. Patient X has this problem. And hey, I watched the video and it got me this far, but I have some questions about it because this patient has, sorry, client, you all call them clients. This client has XYZ particular characteristic. How does that fit within this particular characteristic?
By that point, I'm telling them to go see an actual practitioner.
Okay.
If I might ask, Ms. Cahill, on the screen is the definition of occupational therapy. And I was wondering if you could tell us how what you are doing is not encompassed in this definition.
Give me 1 second.
And this is straight from our rules.
So just going off the first initial line, I do not intend to do any evaluation.
I'm sorry, I could not hear you.
Oh, sorry. Hold on.
Hello?
I'm here. Sorry. I can't read and talk at the same time. My microphone's too far down. Just off the initial definition, I don't intend to do any evaluation, so therefore nothing can be interpreted. There's no treatment planning. The whole process is very informal.
But the process is educational, I understand. Is that correct?
It is educational.
Okay, so now you can enter into a case for the purposes of providing education and indirect need for services and evaluation of an individual for needs of service. And then the last sentence says that these services are provided to individuals or groups through medical, health, educational, and social systems. So it seems to me that that is encompassed in the definition of occupational therapy in Louisiana. I won't want to comment on any other state because I have no knowledge of any other state.
Yeah. Hold on. It's hard for me to read this at the same time. It's so tiny.
Okay, well, let me make it bigger. Hold on a minute. I apologize. I didn't know it would. I asked if everybody could read it, but we can make it bigger. Hold on a second.
It could be you have to make it bigger on your side, Julia, because like it is.
Oh, there we go. Oh,
You have
this
to
is cut
click
off
on
now.
view options at the top, Julia, and make sure you've got it full screen.
There we go.
A little bit harder on a phone too. I'm not sure if you're on a phone, but
I'm on a phone, that's why.
yeah, it makes it a lot more difficult, but that's fine. We're happy to read it to you or to kind of go through it, whatever you need.
So I'm sorry, can you repeat what your question was?
Okay. You said that this was principally education, okay?
Mhm.
And it says in the definition of occupational therapy that the therapist may enter a case for the purposes of providing consultation and indirect services and evaluating an individual for the need of service. Prevention, wellness, and education-related services shall not require a referral. And it talks about workman's comp. But at the end of that paragraph that defines occupational therapy, it says that these services are provided to individuals or groups through medical, health, educational, and social systems. So it seems to me that our definition of occupational therapy in Louisiana encompasses what you are doing. And I would want you to tell us how it is outside of that definition.
So that's where I would have to question what is the definition of social system. Because if I have someone in Texas, someone in Arkansas, someone in Massachusetts,
That's a
all
group.
self
That's a group system of
referring,
education. That's you're
is
educating a
it
group through you're educating a group, and that's what the last sentence says.
so? But how they go about referring themselves, self-referral versus medically necessary referral.
But
That's
again,
where
if you go back, you do not need a referral to do consultation, indirect service, evaluation, and the individual for need of services. Prevention, wellness, and education-related services shall not require a referral. So again, this is encompassing in our definition of, it seems to me, and that's what I'm trying to find out, help me understand why it's not in our definition.
And that's where I'm having a hard time with the gray because OTs do everything. If you talk about the relationship between, in my case, I'm still working with pain. So the relationship between my pain and going down with the grandkids or something like that, that is its own social relationship as well. But the education going with it, is it generalized or is it identified as specific to that person?
Well, if you read a few sentences above, it says occupational therapy services include, but are not limited to, activities of daily living, design, fabrication, and application of prescribed temporary splints, sensory motor activities, the use of specifically designed crafts, guidance in the selection and use of adaptive equipment, therapeutic activities to enhance functional performance, pre-vocational evaluation and training, and consultation concerning the adaptation of physical environments for the handicapped. So again, tell me, are you doing something that's not in that part of the definition?
And that part of the definition, no, because a lot of that deals with splinting in specific activities. Because of what I'm intending to do is more self-reflection. It's
So it's
more
teaching them to
training
adapt
and
to a
guidance.
physical environment? Would it be the
It's
evaluation?
It's not quite, because a lot of what I've experienced as an OT, it's very direct. It's very, here in outpatient right now. So it's very, your thumb hurts, let's try this differently, and telling them directly what to do versus, hey, you have pain in your thumb. How about you go look at what your thumb is doing? Look at this task. Why do you think this is happening? It's more broad and getting them to spin their own wheels instead of saying directly, this is the problem, this is the solution. Fix it.
That's a sort of a, I guess, a simplistic view of our profession, because we are actually attempting to facilitate the patient to come up with their own solutions. That's part of the OT process. If you just had a website and with a bunch of videos on it, and people had to pay for access to the videos, and you never interacted with them anymore, that would not be OT. But if they're going to be watching the videos and following up with you in a one-on-one manner, then that is providing occupational therapy. You're working with them on, maybe asking guiding questions, or just trying to facilitate their own problem solving, their own reflection, but you're there to work with them on that process. That is occupational therapy.
So can I then ask the question, what is the difference between that and coaching? Because I know a lot of the coaching formats that I've looked at is the same open-ended questions with a lot of it.
Brenda?
So I was going to basically kind of say what you had just said, Ingrid, and also that a coaching model is a method of delivering OT services. And so once I became an OT, then things that I provide are OT. It's kind of a slippery slope to try to say, well, I'm going to do this and I'm not going to call it OT. So then I don't need a referral, or I can get self-referrals, or I can, more easily access private paying clients. At the end of the day, I'm licensed as an OT, and that gives consumers of my services an expectation that I'm providing OT, whether at the start of every session I say I'm an OT and what I'm doing is OT or not, if that makes sense.
And that's why I was asking the board disclaimers, anything like that, because again, OT were so broad, it's hard to delineate what is coaching, what's OT, what's life, because a lot of what I'm teaching as well is coming from my own personal life experience.
Your own personal relationship with the client, you mean?
No, my own personal relationship with getting off of pain.
With getting off of pain medication, is that what you said?
No, just controlling pain myself in general.
Okay, you're controlling your own pain and your own experiences and what worked for you and what didn't.
Yes.
It still feels to me that if after the video watching that they are meeting with you virtually, individually, then you're providing OT services. Now, because it's sort of in a wellness realm, you won't need a referral, but you, according to Louisiana licensure, but of course, if you're treating someone in Texas, then you might need a license to practice in Texas. That could become much easier in the future with the compact and licensure in multiple states. It's going to, I'm not sure when it's going to happen, but probably within the next year or so. But it just feels to me like, as my own personal OTAC member, 2 cents is that it feels like this is because you are following up with them one-on-one, that this would be the provision of occupational therapy services.
So
I have a question, Julia. This is Darby. So I think the struggle here, like for you, for us, the whole thing is like a lot of times we'll look at some of the health coaches information, we'll look at things and we identify them as being OT or like OT, or hey, I can do that because I do that. I guess one question for me is like, how will this be presented as to your qualifications and background? Like, how do you envision?
Honestly, my intention was not to present this as OT. It was, here's my story, here's how I got over my pain. I have a background in working in the medical field for XYZ number of years. I've been working on the healthcare field side of it for XYZ number of years in these different types of settings, and notice you guys all have the same issue.
Mhm.
And insert more life and experience stories from myself.
Mhm. And so do you think this is more like what you're planning is sort of more like counseling kind of ish, or like therapy in the sense of, you know, because it's dealing just with pain of like, um, you know, just general knowledge about pain and recovery from pain? Or is it going to be more, you know, specific to each individual person? So like, are you trying to incorporate other things like meditation or things from other fields as well?
Yes, I was still going to plan on doing meditation and first with breathing and all that stuff, because that is how you get over pain. You still got to have the strategies to actually get over it and control it. A lot of what the thought process was still generalized. Here's a piece of paper. Here's some different things you can do. Try them with this video or with this whatever. See if it helps, and just trying different things. Because that's also life. You need to try different things to see if it works.
Right.
Yeah, I think, you know, like anecdotally telling your story is certainly something within the law that you're allowed to do, whether it's social media or whatever way. I'm beginning to think that the devil is going to be in the details and how it's presented and what you're representing, and whether you are again, just offering general suggestions about a variety of wellness interventions and so forth, versus saying, if you have XYZ condition,
No,
you should try this thing to make a difference in your life. And it's
no,
somebody used the word slippery slope, and I think that's what it is, because there are components of you telling your story that could be beneficial to other people by all means, particularly coming with specialized knowledge. But saying, I am or was an OT and I cured myself by doing this, and you should do this too. That's providing occupational therapy services to persons in this state, and you would probably need to have some kind of credentials issued by this state in order to be able to do that.
can I ask you guys then, what are you considering generalized versus specific training? I am not intending on going, okay, we're going to teach everybody who has shoulder pain this one thing. It's anyone who has pain, any joint, here's some general stuff that works for a lot of the pain in general. But is there anything specific versus generalized that would become an issue that you guys can think of?
I see Brenda has her hand up, but let me just say real quick, my answer to that would be, I believe it's the difference between putting something out in the universe for people to access on their own individually and do with what they will, versus having a one-to-one relationship with anybody, whether it's answering questions, giving advice, or anything like that. That's just my take on it. And I'm going to shut up and let the real experts talk.
You're fine. Okay, Brenda.
Ooh, pressure there, Patricia, to be a real expert.
I know, right?
I'm going to give an analogy, Julia. I'm a pediatric practitioner, And at one point, when I was, between OT career jobs, I considered, well, wouldn't it just be easier to just say, I'm a tutor, I'm a handwriting teacher, I'm not an OT. Wouldn't that just be the easier way to go? And at the end of a long reflection, I came to the conclusion that no, that is not possible, because at the end of the day, I'm an occupational therapist and I can't just give generalized knowledge. No matter how hard I would try to do that, I would always see myself going back to uniquely adapting what the patient needed. Because that is what we, by just the virtue that we are OTs, we have that unique knowledge base and we go back to it. And so again, I would caution that this is, like I said, just a very slippery slope. It's kind of like once you become an OT, you really can't unbecome an OT. No matter what we try to call it or label it. Like I said, I had thought of all kinds of fancy definitions of, what I could do and how I could provide it easier without, having parents go get referrals and such. But at the end of the day, I would still be providing OT, which is why I decided not to go down that road.
Okay.
Kristen?
Is it all right if I add some thoughts at this time?
Sure.
All right. Actually, your comment, Brenda, is exactly what comes to mind. And we've gotten these kinds of questions before. Typically, it's from an OT who's been practicing for a long time and they want to retire and not be an OT anymore, but they still want to help folks with wellness and advice and that kind of thing. And they want to know, how can I do that but not get in trouble for potentially practicing without a license? And I always say, my initial thought is, can you turn all that OT training and education that you've gone through, can you turn that off and help patients or clients just be healthier and keep it so general that you can't be accused of practicing OT? And for some folks, I'm sure it's hard. I'm not a trained OT. I mean, you all are the ones who do that. And I can imagine it would be difficult after going to school and providing services for years. But that's something that only the individual can answer. That's something only that you could answer. My other thought is how you would represent yourself to the public. And I know you said you would say, I've been a healthcare provider. That's one thing. If you were to use like the initials MSOT after your name to indicate the degree that you have, I know that's indicating that's just your academic degree, and that's not indicating that you're licensed. But I think you have to be careful the way some state laws and regulations on representing yourself are written very generally. And there, maybe not Louisiana, but there could be other states where you could get in trouble simply because you just put your degree in after your name, because you could reasonably, a client could reasonably assume that you're licensed. And I mean, I know the distinction because I do this stuff and I read this stuff and I'm familiar with the letters that folks put after their name, but it's just the way some laws are written. Some of them, they list out all the potential letters that OTs and OTAs put after their names. And then they add a phrase that says, or anything else that could potentially indicate that you're an OT. So you just need to be careful, very careful in how you would represent yourself to your clients if you're not going to continue your license, and also if you're not going to continue your MBCOT certification. I guess the only other thought, I think most everybody has asked the questions that I was thinking as well. So I think I'll leave it there, but I'm glad to continue listening.
Glad, I appreciate your comment in there too. A lot of the legal stuff is so foreign to all of us, which is why I wanted to reach out to the board.
Yeah. And
Um,
I did also want to say I commend you on a couple fronts for coming to the board and asking the question. You know, I think I hate to say it, but there's probably some folks who just would plow forward and not come to the board and ask the question. So we're glad you did that. And then also for wanting to tell your story. That's great that you want to put that out there and use your experience to help people. So congratulations on both of those fronts.
thank you. Can I ask a question now?
Sure. And then after that, Raylina has a comment. Go for it, Julia.
So I have been going back and forth because, of course, I haven't ever owned a business, so don't know anything where to start with. I have been going back and forth with a OT termed wellness, and I don't know where she is honestly, but she's doing stress management and some more of the cognitive type stuff. Don't believe she's calling herself an OT or anything like that, but having that, the training that we get as OTs, they never leave us. The education we're always getting trained. But in her case, where she's able to more delineate, same thing like before, I have a background in medical. This is how I got myself unstressed. I am now a wellness health coach, whatever she's calling herself. I don't want to say replicating something similar, but doing something similar, but with pain instead. Does that still fall under that same brain?
It was hard for me to understand everything that you were saying. I think I got the gist of it, but I think, like, are you asking like what's like how people are using the title of like wellness coaching?
So I'm more thinking of, I'm still stuck on that delineation between coach versus therapist. Because if we're not, I don't want to give up my license or anything like that. I've worked for it for the longest time. But for the generalization of knowledge and disseminating it to the people who need it, of course, they're going to shoot off emails. So, hey, I have this question, generalized answer, or website where to find all the answers and that sort of stuff. Where is the delineation of OT versus coaching versus
Okay, so I'm going to turn it over to Raylina and then Dr. Van and see if we can clarify some of what you're asking for. Raylina?
I unfortunately couldn't hear most of what she had said. The only thing that I was going to comment on was kind of a dovetail on what Kristen was saying in regards to the letters and things behind names. Even if there wasn't any state regulations on letters and things like that, if MSOT is following a name, there's an implied knowledge base that comes with that. And I think that's where your slippery slope starts. And so I would hate to see this. I would hate to see those lines be blurred even further because of that. Even if there weren't state regulations, that can be, if I saw MSOT behind someone's name, I would automatically assume that they knew something about the realm of occupational therapy. So I just wanted to add that.
Thank you. Dr. Van?
I would like to ask Ms. Cahill, does she believe that her activities would expose her to any liability? And if so, how will she use any kind of professional liability insurance?
I already have professional liability insurance. I just intended to keep it.
As an OT, correct?
Right.
Yeah.
So why would it cover you for this new venture?
That's what I'm still waiting to hear back from my liability insurance.
Thank you.
Person.
Thank you.
As for the letters behind names, I really don't ever put them unless there's someone important that I'm emailing. You guys are important enough where I wanted to put the letters back there.
Relina, your hand's still up, or do you have another comment, or, yeah, I thought so, but I didn't want to assume. Does anyone else have any questions, comments, concerns?
I guess if I may, the only other thing I would add is when at a previous job, I worked with a whole bunch of different healthcare licensing boards, and the question would come up, particularly when it came to an athletic trainer or a licensed dietitian. When you're providing very general healthcare advice about how can I eat healthier, or how can I, exercise to be healthier or whatnot. Now this is in another state. This isn't Louisiana, so Louisiana might be differently. But our rule of thumb generally was, if it's just like you were saying, general advice for the general public that's recognized by the medical community as supporting a healthy lifestyle or wellness, then a licensed dietitian or any healthcare provider could give that to you. But once you start getting into the realm of like going to a dietitian and saying, I have high blood pressure, I need a diet to address my high blood pressure, then it's something different, because I think others have said, it's personalized and it's treating a specific medical condition. And that's the way I've always looked at it, as kind of the line between providing just general nutritional advice versus practicing dietetics, is what it was called in the state of Maryland. And that's kind of the analogy that I'm drawing in your situation. When you start having the personal, like it was already pointed out, one-to-one conversations with people about their particular situation, and you start going down the road of tailoring something to that person, then you're getting into practicing OT, and you should really be careful. And that's kind of the way I look at the difference between coaching versus providing any other licensed protected healthcare service. Because let's be honest, there's a lot of overlap between what OT does and other professions do, and it can be hard to draw a line. And but that's kind of the way I always looked at, something that, you can go to the doctor and say, I just want to eat healthier, and the doctor can give you probably a piece of paper with ideas for how to eat better and have a healthier diet. But when you go to that doctor and say, I have a specific medical issue that I need to eat better for, then the doctor should, if dietetics is licensed in the state, should refer you to that licensed nutritionist or dietitian. So I feel like I'm rambling, so I'll be quiet.
And I also feel like,
Go ahead.
I'm sorry, the other thing that would be really important, Julia, would be, if you haven't already, to do some research and dig in in the OT literature about pain management and things that they're suggesting as treatment, to make sure it's not the same. Because then it's really more in the OT world than providing information like to general,
That is a little difficult, just because a lot of what is in OT literature is also what is generalized. Like all the first lip breathing, the meditation, mindfulness, all that. And you can also go to a yoga teacher and practice the same mindfulness thing that the OT journal said.
Right. Yeah. And that's, that's part of our concern, I feel like, is that it's really hard to not cross those lines, because, as an OT, we do go into the realm of meditation and breathing, and we do suggest a lot of this, but, just making sure that it's not client specific, that it's not, hard, because like Kristen was saying, the medical condition, it doesn't really matter. Pain is pain sometimes. That
helps. And forget
I
who spoke before, but you hit it nail on the head. Thank you.
I also added a link to AOTA's official document on OT's role in pain management in the chat. I hope it's in front of our member wall, but
I see it. Yeah. I mean, I didn't click on it, but Julia,
Yeah.
you have access to the chat. So there is some information and like Kristen said, some links there. And then Glenn's also provided some information as well.
That document is in front of our member wall, so you don't need to be a member to access it. So you can review that at your leisure. We might have some other documents as well. I know before the pandemic, we were in the advocacy side of things. We were working on advocating for OT's role as a non-pharmacological treatment for pain, particularly with the opioid crisis going on. And then unfortunately the pandemic hit and we had to focus on our members' needs on the pandemic front. But I think it's still something that we work on as best we can, but we have only so many people in our advocacy department. We can only advocate on so many things, unfortunately.
Yeah, and that's the trouble that I'm in right now. That's essentially exactly where I'm trying to head forward. And the reason why I'm trying to stay so generalized is I do want to do this work. That's the best way to get to as many people as possible. And in the state of Louisiana, honestly, I don't know where I will be next month because my husband's job brings us everywhere.
Dr. Van, you have your hand up.
Yeah, Miss Kristen, I could not get to that link to that article. It wants me to sign in. I don't have a sign in. Could you send it to me, please?
Absolutely.
So just keep it for future reference.
Okay.
Thank you very much.
Okay, does anyone else have any questions or comments? Dr. Van, your hand's still up, just so you know. Thank you.
Dr. Van, have there been any public comments about this discussion?
No, ma'am, there have been no public comments about this discussion.
Okay, I was just about to ask that. Thank you, Patricia.
Sorry.
No. It's always better for multiple people to ask, but that was where I was going next. So I'm not sure, Dr. Van, what how we proceed with this, or if we, got the questions answered that we have, if we need to make any formal suggestions to her, if we have to follow up with anything in writing. Can you please advise me on the next step?
Well, I think that if you feel this is not the practice of OT, we should probably present that to the board and make sure that they're comfortable with it. If you feel this is the practice of OT, based upon our definition in Louisiana, I think you can advise Ms. Julia about that, and she has to act accordingly.
Okay, does anyone have thoughts? I mean, it's hard for me to say whether it crosses a line because I feel like she's in progress of putting it together, and we can't really view something to see what she's going to do. I don't know if that's how other people feel, but I mean, hopefully with our discussion today, we've kind of delineated like that little gray line of what not to cross, but I don't know.
If you want to you can table the matter, Darby, for to the next meeting, or give her 2 meetings, and she can present an example of the product she's going to utilize. And then you could talk about that at that time. If you feel like you've not seen enough information, you can request information from Ms. Gale.
I'm going to turn it to other members of OTAC to see what their opinion is. Would y'all like more information, or you feel like you have enough to feel like this is not OT, or are we still on board that this really is overlapping with as an OT too much?
Darby, Kim, and Glenn have their hands up.
Oh, sorry, I didn't see that. Okay, Kim.
Hi. I just feel like it's been said many a time, this is a very slippery slope, and that there may be that one client that is going to, really need some guidance as an occupational therapist? And, would you be able to switch from coaching to an OT to help them through this process? And I guess my question is, why don't you want to do this as an occupational therapist? And maybe that's defined more in your letter. And then, as Dr. Van brought up, the liability could be a problem. That would be a concern of mine. So those are my thoughts.
Julia, would you care to answer that, or do you want to go to the next set of questions? I actually don't see her on here anymore.
Julia, she emailed me saying that her video cut out, and so I'm letting her back in right now, but she's not joining back.
So she may not have heard that, Kim.
I guess I'm unclear of what she's really asking too.
I think from her email, I mean, she kind of gave us an idea of what she's thinking, and then just like asked if would this be allow her to act as a coach, or are there other steps that she needs to ensure that she's acting as a coach and not as a therapist as she pursues this new role? That was her specific question on the email.
Right, I see that.
But, it seems like, and hopefully she can correct me if she's wrong when she comes on, like she's in the process of doing it. And I think, as we all would, you kind of want to know if you can before you like spend the time and energy and money to do it. And a lot of it's going to depend on how it's done. And like you said, Kim, if there is a coach, I guess the question to me would be like, would she refer to OT? Or is she going to try to then switch and get a referral and make sure she's not crossing state line? What are her processes for that? Kind of waiting for Brenda and Glenn for Julia, if that's okay, because I'm guessing you have questions for her.
And I guess my other concern is pain. That can be very difficult. I don't know.
Yeah.
The question about
go a lot of directions.
Mm-hmm.
Sorry. The question about why can't you just do this as an OT was one that was brought up when I shared this with my colleagues. So I'm glad others have pointed that out.
Yeah, and I think someone mentioned it earlier, and her answer, I tried to take notes, was that she wouldn't be, well, it was kind of more in Dr. Van's thing going through the definition, that she would not be doing evaluation, she would not do a treatment plan, and it would be much more informal.
But if you're still, like I said, can you turn off all that OT training that you've had? Can you just flip that off and stop yourself from starting to talk about ADLs and all? So,
well, I mean, I think that's the golden question here and like we're being asked to either assume that she can, trust that she can, and make a decision as to whether or not she can do this. I don't know. Brenda, is your question specific to her?
No, well, mine was more of a comment along those lines, that just to sort of reiterate that, like, if I write a blog for my website or I put a video up on my website, I'm being general, I'm just being a teacher, I'm just being a coach. Once a patient, a client, a person asks me about their specific condition and I give some specific answers, I have entered that process of evaluating and assessing and tailoring treatment. And so I think that's where in my mind, that's where the dividing line is. Once I'm giving things that are personally tailored to someone, I'm practicing occupational therapy.
So my question, I guess, in response to that, Brenda, is just to kind of play devil's advocate. If that blog that you write, you're using your OT knowledge and you're sharing that on your blog, is that coaching or is that OT? Because the knowledge that you're sharing is underpinned by your OT training or coming at it from an OT perspective. That's also
coming at
my
it from an
concern.
OT perspective, but simply general information for anyone to simply read or simply absorb
Okay, all right,
versus a specifically tailored
yeah,
um,
Intervention.
technique that I'm offering. You know, if I were to do a video and say, this is how you teach a child to get dressed, that's general knowledge. Probably a teacher could put out that knowledge. Probably a mom could put out that knowledge. That's simply general knowledge. If a mom would then call and say, my child only has use of their right arm, how would you tailor this video? Now I've stepped into my OT shoes.
okay.
Glenn Wallace has his hand raised.
Yeah, Glenn, I was just about to call him. Thank you.
You're welcome.
That's okay. So in looking at the letter and kind of hearing everything else, I think, I think what this looks like is I think it looks like it sounds like two different things. Like there is a very real desire to share a story, and with that story kind of draw from personal experience. But then also there also looks like a desire to for a business to be established along the way also. So I think in terms of, sharing a story, there, like we've talked about, I think there's nothing wrong with that. And I think there's definite avenues to story sharing, which doesn't preclude, which doesn't cross any OT lines per se. You can write an autobiography based on your story and then still have your OT letters come behind your name and then release that book, and nobody's gonna say that, oh well, that's practicing occupational therapy because you just wrote an autobiography about your journey through fibromyalgia or whatever it is. But like, to Brenda's point of like general versus personal, then I think then it does cross that line. But based on what I kind of like see with her letter, is it's kind of like it also kind of doubles as like an exploratory, like an exploratory entity in the sense that it's like, how people who are entrepreneurs, they put feelers out there to kind of see, are these entrepreneurial services, you know is it something that could stick, and is it something that I could potentially like capitalize on? And so if there is a if there is a business venture to pursue, and if that business venture includes personalized services, then I think what would be needed would be a formal business plan for us to review, with in the same way that, like, you bring, like, in order to get funding for the business, you need a business plan, then the bank gives you the loan. In this sense, the capital from an OT standpoint is the board's blessing for this business, which would include OT services. So I think if the board is going to extend that, I don't know, quote unquote profession capital, if we will, to have more than just a letter of intent to explore, pursue, whatever, like a more formal thing that we could say, oh, we understand what you're doing, we understand how what you're doing is going to be executed, and we can either A, say we can sign off on this, or B, we can say no, that crosses the line, and these are the different ways that it crosses the line. So I don't know, that's kind of my opinion on kind of how things are and where they are right now.
Okay, thank you. Patricia, your hand was up next.
Yes, even if it were to go to the board, it would be in the sense of, okay, so let's say all of you all's questions are answered, or we're presented with a business plan or an outline of how this is actually going to work. Then you all say, and obviously if you all say it's OT, end of subject, we're done. But if you were to say, okay, based on this that she's explaining, I think this would not cross the line, and we'll recommend to the board that they have that opinion as well. at the end of the day, we don't promise anybody anything and we don't give legal advice. She really should, in the best instance, I mean, kudos to her, as you all have already said, kudos to her for coming to you all. That was very, very much full of integrity and full of and the proper way to do it. But all she's going to get from the board at the end of the day is, based on the information that you have provided, and the recommendation of the OTAC, it does not appear to the board that this would constitute the unauthorized practice of occupational therapy. However, you must consult your own private attorney. We don't give legal advice, and if it doesn't work out exactly this way, we're still going to have to pursue you if we get a complaint. So whoever said it, may have been Glenn or whoever, but yeah, this is an information gathering exercise for her as much as anything else. And I don't think that even at the end of the day, what she's going to come up with is a gold seal piece of paper that says, I can do whatever I've said I'm going to do, and it's never going to be against the law. That's not what we're going to say. Even if at the end of this road we say, yeah, based on what you're saying, the board's willing to say, go for it. It doesn't look too bad to us, but if it doesn't work out the way you have it planned, or you cross that line, you still would face the risk of it. So we wouldn't be giving her a legal free pass.
Yeah, and I guess that's my like question here, and thank you for that clarification, because I'm not really sure, and I guess I was kind of alluding to that earlier, and Dr. Van answered it, is like, what our role here is, like, because we don't have a clear-cut picture, we don't know how it's going to play out. We don't know if she's going to get that specific client that would have her cross the line. So it's almost like, like if we give her the blessing, then it could still happen. If we don't give her the blessing, then then it's null and void. But I was just a little confused as to like how we proceed with this as far as recommending to the board, even if we get her business plan, which I think is a great idea, Glenn, but like it doesn't really mean that it's not going to ever come up with an issue, like an ethical, it's like any OT or anyone for that matter, that they're never going to cross the line.
No, I wasn't suggesting that like just by having business plan equals all the ethics check out. I was just saying.
No, I understand.
Okay.
That.
Okay.
Yeah, I got that, but I'm just saying, like, we can potentially get everything in writing and it can be perfect to where we feel like, but then it doesn't mean, like Patricia said, someone may not complain that it's crossing the border OT. You know what I'm saying?
Oh,
so,
right. A bad actor with a good plan is still would equal bad actions.
So, like, I guess, I don't know if my question is to Patricia or Dr. Van, of like, what do we need to do as OTAC for this situation? What are they expecting from us?
Patricia, you want to go first?
Sure. So I think if she can't get reconnected, I think that we could assist you, Darby, in writing a letter on behalf of OTAC saying, we hope that the discussion was profitable for you. We hope it gave you some direction or sense of our thoughts on the issue. Without more facts, without more specifics, we're unable to go any further. And frankly, we don't know if that was just what you wanted was the information, or if you wanted us to take some sort of formal action, which would be making a recommendation to the board to answer your question, whatever, blah, blah, blah. It's not going to sound like this, but you know what I'm saying. Right. Just send her a letter acknowledging that she came, she asked us questions, we asked her questions. What else, if anything, does she want from us? And based on what that is, we could reply to her that if we were to go further, we need, at a minimum, the additional information such as Glenn and you all have already discussed. That we're at the end of our rope as far as our general thoughts and opinions about the matter. Unless Dr. Van has a better idea.
Well, Actually, no. I think you've said it very well. I think the biggest thing that you all need to decide is, do you think this is the practice of occupational therapy? If you need more information, we get it and we come back and discuss it again. If you're comfortable saying this is OT, then that's fine. We're done. And I'll be happy to write the letter thanking her for what she did and all the stuff that we said. But again, Pat said it best. We do not give legal advice. We're not going to give her a pass. And
Right.
you never know how she's going to cross the line in the future. And we actually have this kind of problem with docs too. I mean, you got to remember that even if she did this for free, it's still the practice of OT, it appears to me, and she would still have the board regulating it, even if she was doing it for free. You can't, you can't give your services without being a professional.
And I mean, I just feel like, and I think this theme has come across the whole time from other OTAC members, of that it could be OT, but it may not be OT. It depends on how she does it. And if she can take that hat off. And like, I can't answer that question, because yes, it could very well be OT based on the definition and some of the things, but she could do it in a way that may not cross the line. But it's really, it's
Okay, well, let me just say this to you. There are a couple of unique laws in Louisiana about doctors, but let's say, for example, I'm sitting in a restaurant, okay, and the guy at the table behind us falls out of his chair and he has a heart attack. And I begin external compression and cardiopulmonary resuscitation. The guy gets out, he lives, he goes off. Fine. That person, and I don't charge them for it. Louisiana law says I'm a good Samaritan and I have no exposure from a liability, except for what could be construed to be gross negligence. In the alternative, suppose I fractured 9 of his ribs, flailed his chest. That's a different story. I'm still an MD, will always be an MD, and have some liability. So the OT is always going to be an OT and will always have some liability. So
right.
she said it. The insurance company hadn't even told her what she could do.
My gut feeling is that this is practicing OT, but the communication was really bad. So personally, I like the idea of what Patricia said, of sending a letter saying, I hope that you got a sense of our thoughts and concerns. When you have more of an exact plan of what your sessions would look like, we would like to see either a business plan or some specific details about what your sessions would look like before making any other recommendations. I think she said that people would watch pre-recorded videos, but then follow up with one-on-one virtual visits with her. And then what she described as what would happen in those virtual visits, to me, is OT. So that my gut feeling is that this is OT, but with the communication being bad, I'm more with what Patricia said right now, of just saying we need more information.
Okay. I mean, that's kind of where I think we're at and going. So that's fine. And especially because she didn't come back. So we will address this in a letter to her and follow up information, and then see what her response is. So
well, let's let Pat draft the letter and we'll send it out. I'll sign it on behalf of the agency and the advisory committee. Get it moving fast enough for her.
That sounds great. Okay, thank you. Okay, so although we're not gonna quite follow the sync of the agenda, I feel like the next thing we should do would be move to executive session so that we can use the remaining time with the rules and the regs. Is everyone okay with that? Dr. Van, don't we have an executive session matter?
I think we do.
Okay, and then I'm not sure, please guide me on, are the new members allowed to participate in that?
The new members, yes. But yes, they are, but I think only one of you alternative can vote. I don't think we can have 2 votes because it's slotted spots, but Pat can correct me if I'm wrong.
Right. The only the requisite amount of members can vote, but they can go in. You can invite anyone you choose into executive session, and because they've been sworn in to take office at the end of yours, they can certainly go in with us.
Okay, great. I'm trying to be mindful of doing the right thing. So at this time, I will make a motion to move into the executive session.
I second it.
Okay, all in favor?
Hi.
Aye.
Anyone opposed or abstain? Okay, I'm not sure, Kristen, if you would like to attend or not, but
I have another Zoom call to get on at 1 o'clock, so I'm gonna hop off and bid you all a good weekend. So I can get myself some lunch before that call. So, but
Have a
enjoy.
great weekend.
Always
Happy
glad to help.
Thanksgiving.
as
Same to
always,
you all. Happy Thanksgiving and be safe if you travel.
thank you so much for over
You're
the
welcome.
past 6 years, your continued support for OTAC, as this may
Of
be the
course.
last time that I contact you for OTAC business, but I will definitely stay in contact otherwise.
Sure, absolutely. And
But I mean,
take care,
I
Darby.
can't let the OTAC committee understand how valuable you have been to all of us, to me, to help us with all of our state affairs. So thank you
Well,
so much.
it's my pleasure, and I congratulate you for serving and all of you for serving. I know you all have busy lives and you have jobs and everything, and this is one other thing to add to your plate, but I commend everyone who wants to serve on their board. So, but it's my pleasure to help.
Thank you.
Thank you.
Okay, so if everybody now can just join the room, we can move into the executive session.
Yep, it's open for everyone. Mary and Kathleen, if you want to press join at the bottom of your screen, it'll put you into the gathering room for executive session. Miss Sandra, you gotta press join at the bottom of your screen to add you in. Tracy, I'm gonna leave you out.
Yes, ma'am.
Thank you.
Okay, I'm gonna make a motion to request a letter of recommendation from the supervisor of applicant number 296217 from the supervisor under her temporary permit to proceed with our further recommendation for the applicant.
This is Kim, I second.
I'm
Thank
sorry,
you.
who seconded it?
Kim.
Kim.
Kim?
Okay. Thank you for everyone's input on that.
We have to vote?
Oh, all in favor? Thank you. Say aye.
Aye.
Anyone oppose or abstain? And I don't think there can be public comment. That's it. Okay, do y'all want to take a quick break before we have the rules and regs, the use of title doctor, which Patricia put together some stuff, and I have something in the rules, and then we have the definitions section, and then the temporary license section if we get to it. So does everyone want a quick break?
Yes,
Yeah.
please.
You want to take your vote?
Yes,
I'm
we did.
sorry?
Do you want to take your vote in the public session to address the executive session matter, or you come back after the break to take the vote?
I'm sorry, we already did it. I motioned it and Kim seconded it.
I'm sorry, I missed that. I apologize. Please
No,
forgive
that's
me.
okay. Please, please, please always double check that I'm doing the right thing, but we did.
Okay.
This time. Okay, so let's see what time it is. How much time do y'all want? 5 minutes, 10 minutes?
5 minutes.
5 minutes? Okay, it's 11:43. So I'll see y'all at 11:48. Ingrid, when we do this next section, would you be able to pull up what Patricia did, or do you want me to share the screen? Because I have it up. You're on mute.
The title of doctor?
Yes, the email that she sent this morning.
Yeah, yeah, go
Okay.
ahead. Mhm.
I'm sorry, you'll pull it up, or you want me to?
I can pull it up. Yeah, I can pull it up.
Okay. Yeah,
Let me find it.
I have it up, but there's just a little glitch that we have to make sure we mention. Dr. Van's pulling up the role of OT and pain management.
So you don't want me to share the screen yet?
Yeah, well, I mean, I guess, let me see if he wants to, like, if Dr. Van, do you have a comment about this document that you have up, or? I must not be back yet from the break, but
well, I'm going to share the screen with my email then, so I can see that.
All right, so this next thing that we're talking about is the titles of licensees. It's section 1951 in the rules. And it's specifically the reason that we've already addressed this section, but we're going back because we had some concerns about the use of title doctor. And so when she pulls it up, I'm gonna look at
Did I pull it up? Are you guys seeing?
So it says that you're talking, but it still has Dr. Van. I think he might have to stop. There you go. But we're viewing Dr. Van's screen.
We are still viewing the Dr. Van screen.
That's what
So if you want to, I'll get out, let me get out the way and you can share yours. How's that?
Great,
Okay.
thank you.
Does everyone see the screen that
we can
says
see it now. Yeah.
follow-up agenda item, use of term? Okay.
So so basically just a little bit of background for Kathleen and Mary. We are going through the rules and regs and different sections we've done, and some we have 3 sections sort of left, but in a little bit more to address. This is section 1951, but I just want y'all to know as it's pulled up here, because Patricia put this together because we were asking for some guidance. So basically we wanted to try to marry what we had and what we discussed with the actual state statute of the law for physicians. And so she put it here, and then there's just 2 things to note. One is the part that you see in black here does not reflect what we've previously reviewed, and really the only thing we did was I think we corrected the his to their. But then the other thing to note is you also received a copy of the rules that were revised with the date 11/12, that I personally did the same thing, but it's a little bit different. But I didn't get a chance to like super compare them. But what we're going to look at is what Patricia did, since she's the legal counsel and has much more knowledge about that than I did. So I just want you to know when you see it in the rules, it's going to be a little different, and that's why. So we have A and B, like I said, that have a little bit of revisions, but it's nothing really content. C would say any person who is issued a license as an OT under the terms of this chapter and who has earned a doctoral degree in occupational therapy may not directly or indirectly assert, represent, make, publish, disseminate, circulate, or place before the public by any means or medium, whether written or verbal, an advertisement of the availability or sale of professional occupational therapy services using the term doctor or DR period in conjunction with, and it should say their name. Oh, Ingrid. It would be their name unless they designate the degree to which they are entitled by virtue of their diploma of graduation from a school or other entity, professional or otherwise. Then it goes on to say, additionally, one, in a written communication, a licensee who has earned a doctoral degree in occupational therapy may use the initials OTD, DRPH, PhD, or ED as applicable following the licensee's name. In written communication, a licensee may use the title doctor or DR period preceding the licensee's name if the licensee's name is immediately followed by an unabbreviated specification of the applicable doctoral degree held by the licensee. And in spoken communication, while engaged in the practice of occupational therapy, a licensee may use the title doctor preceding the licensee's name if the licensee specifies that he, she, or they is an occupational therapy practitioner. So that's basically marrying the two laws. Patricia, thank you so much for doing this. I'm sorry I didn't get with you and share what I had done. I didn't honestly realize that you were working on it. So that's my fault. So
oh no, that's perfectly fine. I just panicked when I saw on the agenda that it had follow up and my name behind it. So
yeah,
so
it's okay. I did my best. I went up to the statute, and I mean it's pretty similar as to what I had, but I just wasn't sure how much we could take out. So yeah, I think it's honestly pretty similar, but I mean, I think if everyone's okay with it, except changing the pronouns, then I think we could, unless anyone has any questions or comments, like go ahead and vote to accept this as written.
And just, sorry, Darby, just another typo. The first use of the word license should be license, not licensee.
Yes.
thank you.
You're welcome. Otherwise, it looks good.
I think it really reflects what we were trying to achieve, to make it very clear to OTs in what way they can refer to themselves as doctor. I think it's.
And I mean, if you read the statute, it's almost this, but it gets even more details and some of the stuff that I as well had avoided or had omitted. So I feel like this is very congruent with that without referring to the statute, which was our goal. So I'll make a motion to approve the revised section of 1951C. With the changes, with the edits of the pronoun.
I'll second it.
Thank you, Ingrid. All in favor, please say aye.
Aye.
Anyone oppose or abstain? Okay. Any public comment, Dr. Van, on the use of doctor?
None at this time, ma'am.
Okay, so now we can move on to the definitions, and the cloud share is a separate document. So we currently, Ingrid, if you don't mind, would you mind flipping to that?
The cloud share?
Yeah, the definitions document that's in there. So basically, just to remind everybody and update, we have definitions in two places in our current rules. We have them in section 1903 and 4903. We discussed last time having them all in one place. I am fine with that. I proposed, in what I did with this, that we divide it into three sections. So we have a regulatory section, which was previously 1903, a practice/official document section, and you'll kind of see that, and then a practice one. And I'm not married to these terms, by the way, this is just a draft, that would incorporate the ones from 4903. So if you currently have a copy of the rules and the regs, Ingrid and I made a lot of changes to the definition sections prior to us even starting this back in May. So I tried to merge all of the documents put it back in ABC order because at some point we were doing process and domain and we switched that back. And I tried to leave some of the color coding, and then Ingrid and I divided the list that we made from multiple meetings as we kept a tallying list of things we needed to define. So Ingrid and I divided that list up, and those are in table format. So if y'all can just kind of grasp your head, and I try to keep it simple, even though it looks really, really complicated. The red stuff that we go through is what Ingrid and I did in May. The blue is the revisions that I've done since. And then the black are the current rules without revisions. And the green is what we voted on last time. And then anything that's in the table formats, which you'll see as we get to, is what Ingrid and I, there are additions. And I also went off the rules, the minutes from the last meeting, because Ingrid made this amazing table for everybody of what definitions to delete, what definitions to update, what to leave with no change, and definitions to add. So all of the ones are added, all of the ones are left with no change. There is one that we'll get to of activity that we said to update. And some of the ones we deleted, I kind of made a comment. So if we're just gonna go ahead and go through this. And then I feel like if we go through it and then we can kind of discuss how they're divided, that might be better. Just so everybody can get some organization for that. So here's where I put like number 1 under the definitions of regulatory. So the first one was applicant. We voted on this one last time, so that would be the same. The blue would be application. And so we said it quote unquote it needed work. So this was the definition, but I think the reason we said it needed work is because we had a written request and it's now done online. So this would be the definition for the application: a request directed to and received by the board upon form supplied by the board for a license to practice occupational therapy in the state of Louisiana. Am I missing some words here, or can I not see your?
Could you say in a form and manner?
Where?
In a form and manner required by the board.
As opposed to the way we've got it here with all this stuff about forms, Dr. Van, to simply say a request directed and received by the board for license to practice OT in a form and manner as prescribed by the board.
Yes, yeah. That way, if we change something, it doesn't have to go back to a new rule.
Got it.
Okay.
I'm gonna write that down right now.
Ingrid, are you able to revise this?
No, not directly on the cloud share, but
so would it be easier for you to pull up the definitions document so you can revise it as we do it?
You didn't send me this that you've got with the blue and the red and the black and green. I don't have that as a Word doc.
Okay, I'll send it to you real quick because I know that makes it much easier for you. I'm sorry, I thought I sent that to you. Give me 1 second and I'll do it.
But I don't mind just doing it on a separate one and then putting it in there later if we want to just continue with this.
Yeah, that's just double work for you. And then when people see it to vote, we know exactly what it says. Just give me 1 second. I'm about to hit send. Sorry guys. Okay, Ingrid, I sent it.
Okay.
I'll just give her a minute.
Yeah, I'll have to give it a minute.
Yeah, that'll just make it easier because you constantly are, editing.
We might want to keep going. I wrote what Dr. Van said separately because our here at work, it takes longer to get the emails through and then takes a long time to open things because they're constantly scanning for viruses.
Okay, so we'll move on. All right.
Yeah.
Sorry about that. Okay. Or it was in the email that I sent to Olivia, and I think I CC'd you when I sent her all the documents and the agenda. So you may already have that email.
Look there.
Okay, so approved course. So we refer to this, and this is also just for your knowledge. You see at the end of the definition where it has section 1969, that's where we refer to it in the document. So if somebody wants to, I'm not asking you to, but if you wanted to see how it's used in context, because sometimes things change with different contexts, that's why that number's there. And I think this is referring to in the continuing education part. A program, a course, a seminar, a workshop, a self-study, independent study, or other activity meeting the standards and approved by the AOTA by an AOTA approved provider, the NBCOT or the LOTA. So that would be how we would define the approved course that's referred to in the document. Any comments? I'm just gonna assume that there's no comments or questions unless you speak up, and we're just gonna roll through them. Okay, association. I don't think that this is referred to in the document. I've tried to check it all. I don't know why. Maybe I skipped this one. Yeah, I'll have to check that because usually I've tried to check every single word to see if we even used it.
I thought last time we said we didn't use it.
No, I know we say LOTA, but I don't think we ever say association because there'd be confusion between AOTA and LOTA. So in the document, we say LOTA or we say AOTA, just like the one above where we list them out. I don't know that we use it, but if we don't use it, we would get rid of it, correct? Yeah.
Yes.
Okay. So I'll take a minute when I kind of look that up. Okay. So we said last time to take out board, but I feel like we need to keep it in because we refer to it a million times in the document. And I just don't want there to be confusion between like AOTA board, LOTA board, like there's a lot of boards and organizations. And I just think that like we refer to it and maybe need to let them know that that's who oversees OTAC. Because I don't even think everybody knows that. I don't know if overseas is the correct word, but I don't know. I mean, thoughts. Because last time y'all were like, oh, we can do without that. And I'm like, I don't know. After looking at the document and how many times we use board.
I mean, should we refer to it every time as LSBME?
I don't know. I mean, literally, so the other thing I tried to do in the draft is change the punctuation to a capital because we agreed on that. And there were so many, it won't even let you do like find and select. Like there's so many times we say board. So if we want to change it to LSBME, then I guess we could, but I guess that's a bigger question. I'm fine with keeping board. I just think we need to state in the definition.
I'm gonna stop this share and start a new share because it finally came through. Hold on. Now how did I list? There we go. Screen share. Let me see if this is the right one. I've got too many things open.
That's it.
Is this the definitions? Are y'all seeing it?
Yeah, that's it. Okay. You did it.
All right.
Like in the lottery.
I think it's fine to say board, y'all. That's a defined term in numerous rules and in statute. So I think that's fine if it simplifies things clearer for you.
So do you think the word overseas is the correct term? Like, I struggled with that word, but.
Don't we have a current definition for board in our current definitions?
No, it says the Louisiana State Board of Medical Examiners. That is the definition in black.
Oh, so what you wanted to do was clarify that the Occupational Therapy Advisory Committee provides recommendations to the board who then gives final whatever.
Right. Right, so I was trying to keep it simple, but last time we said we were gonna take it out. I don't think we should take it out. I think we need to leave it and say that the board is above OTAC, so that if somebody needs clarification of who the board is or what the board is, they can come to the definitions and see that.
Okay, so it'll,
To have it easier in the definition, because I was gonna say, don't we cover that in the whole chapter on the role of OTAC?
We do.
Yeah,
so, but they don't, I mean, yeah, you'd have to say who licenses and regulates the occupational therapy practitioners and who overseas, yeah, not really overseas. Who?
no, I just didn't know the word. I struggled.
Yeah, no, I know. I'm trying to think of a synonym that's
Or
Govern?
like it's
Is it govern?
governs,
administers.
administrates, governs,
Regulates?
No.
Yeah.
Yes, no.
yeah.
Tells you what to do?
Facilitates. That's
Or-
not.
Or something about like the OTAC is well, I mean, that's evident
Facilitates.
in the name OTAC.
Facilitates. I'm fine with
Facilitates.
facilitates
Why don't we just say,
and facilitates.
licenses and regulates the practice of occupational therapy in the state of Louisiana, using recommendations of OTAC?
There you
Well,
go. Or no?
But they
don't
don't, we
think
don't recommend
everything-
who to license.
I
Like, we
don't think, yeah, I don't, yeah, that's too inclusive.
Okay.
I think whoever said facilitates is probably good. Practice of occupational therapy, comma, and facilitates the Occupational Therapy Advisory Committee.
So that's already in there, yeah, okay.
Now,
can
if
just-
you want to keep, I'm a brevity over verbosity, but I do think the idea of the recommendations it's a good idea to memorialize in some way. So possibly consider this, who facilitates and accepts recommendations from the Occupational Therapy Advisory
it.
Committee.
Yep,
Who facilitates and what?
Accepts recommendations or receives recommendations.
or solicits,
Well, now you wouldn't always solicit, but we would receive if you sent it.
okay, so that's fair, thank you. Okay. All right, thank you.
Did you say receive and facilitates?
No, just receives.
Okay.
Wait, regulates, practice. Oh, no, we do need to facilitate.
Yeah, facilitates and receives recommendations from.
Thank you, whoever caught that. Okay, so it's the Louisiana State Board of Medical Examiner, LSBME, LSBME licenses and I don't have the list here. I didn't print it out because I don't know. Do we have a separate LSBME definition? I think we might. I just think that would be.
Could just say, LSBME regulates the practice of occupational therapy and facilitates and receives recommendations from the OTAC.
Okay, thank you. All right.
Would it
so
be
then you
better
can
to
give-
drop the and between therapy and facilitates and just put a comma?
I think you need the and because you've got
both of the other?
license and regulates and
Okay.
comma and receives and facilitates and receives.
Okay. So facilitates and
Ingrid-
receive is actually a separate function.
Yes,
Right.
And
Exactly.
joined together. Okay.
correct.
And
It
Ingrid,
makes
you can
sense
get
that
rid
way.
of the last part that says who oversees.
That says, I don't know why this is not working. There we go. Yes.
Thank you. Okay, So again, this is under the regulatory part. One of the definitions that we wanted to add was compact privilege or compact permission. And I'm not sure between which one, Dr. Van, we would need your advice as to, or is.
Well, under the present law, let me pull up the law just to be double sure. I'll get to it right quick.
Yeah, I thought it was privilege, but we initially thought it was going to be permission.
Yeah, it looks like it's, I'm gonna find it. Give me a second.
Okay.
I
So
apologize.
the definition would be, and we refer to this in section 4931, a license refers to the standard license granted by your home state. A privilege to practice is granted by other compact member states after your home state license has been approved. And then there's the, like where we got it from, the website.
If they use the term compact privilege,
Privilege, yeah, okay, that's what.
that's in the law.
So Ingrid, I guess we could get rid of the word compact permission. And then just look at that definition and make sure you feel like it's okay. A license refers to the standard license granted by your home state. A privilege, or should it say a compact privilege, to practice is granted by other compact member states after your home state license has been approved. Is that clear? That like you have your home state license and then you have to apply to the other state compact once you have your license in your home state.
Well, if you're just really trying to tell them process, why don't we just simply say, because you never know when they're going to change the rules or their operation, and that would be a big to-do, but still we would have to change our rules. Just say in accordance with the rules and regulations of the compact.
Well, and two, if we're writing this, we're not writing this to apply to everybody. We're writing this to apply to Louisiana licensees or compact licensees. So you might want to say, a privilege to practice granted by a compact member state or something like that. I mean, I don't know. That feels a little too.
So I'm trying to find, I'm looking in 4931 to see how we refer to it. Okay, so here, just so you have the context, it's
Now,
under
they have
the
a definition of compact privilege if you want to know that, Darby.
Yeah, but I guess before that, like just so you hear how it's used in context, it's in our rules and regs under suspension and revocation of license, refusal to issue or renew, or unprofessional conduct. And it says the refusal of the licensing authority of another state to issue or renew a license, permit, certificate, or compact permission, which now we know will have to be privileged, to practice OT in that state. So it's just a definition so that people understand what a compact privilege is.
Okay. I just think saying a license refers to the standard license granted by your home state. We should drop that and we should just say compact privilege, a privilege to practice granted by a member state of the interstate compact for OT, whatever your commission is. After your home license has been approved or all that. I mean, I just think compact privilege means a privilege to practice granted by a member
Another
of
state.
A remote state. Use the term remote state to be consistent with their own definition.
Okay.
Perfect. Okay. Yeah. So it's just, I feel like it's important when we go to these definitions to see how it's used in context. So we know.
Agreed. Yeah.
That's why I try to go through and put all those numbers of where it was referred to, because it's so helpful for me to be like, in what way are we referring to it? Okay. So privilege to practice granted by a remote state. Perfect. Pretty good with that one. All right. The next one would be, we said continuing competence, but that is not a term that we use in a document. But we refer to the position statement in section 4905. So continuing competence would be the process in which we could just say OT practitioner develops and maintains the knowledge, clinical reasoning, interpersonal skills, performance skills, and ethical practice necessary to perform their OT responsibilities. And that definition comes from the final Model Practice Act of 2022.
So we don't use continuing competence anywhere in our rules, but we do refer to a position statement that uses the term.
Yeah, I'm going to pull it up real quick. So we have, it's under the subchapter B, Standards of Practice in 4905. And it says, this subchapter provides the minimum standards for OT practice applicable to all persons licensed to practice OT in the state of Louisiana. An occupational therapy practitioner abides by the most current AOTA Occupational Therapy Code of Ethics and by the most current AOTA standards for continued competence by establishing, maintaining, and updating professional performance.
Darby, just
Sir?
so you'll know, the compact law defines continuing competence. If you want me to read that to you to make sure you understand what it says.
Sure.
Continuing competence / education means a requirement as a condition of license renewal to provide evidence of participation in and or completion of educational professional activities relative to the practice or area of work. And that's the compact definition.
But my point is that we do not use that term in this document. So if technically we don't need the definition. Is that correct?
Okay.
I'm asking too, like, I went on the list of saying like, these are the things we need, but we never refer to it other than to say that like an OT abides by the code of ethics and a standard for competence, the standards for continuing competence. Like if you look it up in the rules, we don't use that term.
But we do, well, we refer to the position statement that uses the term.
Right, and I think later in the section of official documents, I refer to it. Now we do use the word service company, but we define that later. So any position statement, like the standards for continuing competence in OT, I'll have that with the purpose of that document and the link later in the definition. But we don't use the words continuing competence in the document.
So therefore, we don't need the definition.
Agree, but it was on the list to put in. That's why I'm.
Gotcha. Okay.
So what I try to do, just so you can get in my brain for a second, because it's very different, is that I searched the document to see where it was used, to then search to find a definition. Like, because if it's in, a position paper or a position statement, then I'd go find it. But it wasn't used, so that's why in the parentheses it says not found in document.
Okay, so we're going to get rid of this because we're not using it.
Correct.
Okay.
But it was on the list, or yeah. All right. So the next one is department, which we agreed last time to nix. Then this one is good moral character. So in black is what was in there, and then you have update the definition per minute of 1013. Why do I not know what that means?
It must mean that in the minutes of 1013, we thought that good moral character should be updated.
Yeah.
Oh no.
Oh yeah, but I don't know. Yes, that's exactly right. It says to update that definition in there. So
I guess we didn't do that.
I don't know, but how did I miss that one? Maybe I did. I'm gonna look to see where we use good moral character. I think it's in the part about the ethics, right?
Um,
Well, according to my search just now, the only place we use it is in the definitions. Wondering if that to be true, although I'm doing a find. Oh yeah, it's in the qualifications for license. To be eligible for a license, an applicant shall, number one, be of good moral character, as defined by 1903. So as defined by the definition. That's how it's used.
okay.
So that's a requirement for license. Dr. Van, does the State Board of Medical Examiners have a definition since that's a requirement for a license?
No, it is one of those things that they interpret at the board level and the disciplinary area.
Why did we have a problem with this definition? I mean, it looks pretty straightforward.
I think it's just on the list to do. I'm not sure we even, let's read it. And as applied to an applicant means that the applicant has not prior to or during the pendency of an application to the board been guilty of any act, omission, condition, or circumstance which provide legal cause under 373011 for the suspension or revocation of OT licensure. They have not, prior to or in connection with this application, made any representation to the board knowingly or unknowingly. I mean, this just sounds like a very like part of the application.
I know. I don't know why we thought we had to update it.
I mean, we can leave it if we feel like we should leave it. I mean, I don't know what Tricia would say, but I kind of feel like it's super wordy. But I guess if all that stuff needs to be in it to define good moral character.
Yeah, I'm easy. If y'all want to be, that's something that is worth being inclusive.
Okay.
The main thing you want to do when you put all of things like this is you want to make sure that you're still making it clear, including but not limited to. Once you start listing things, people think the list is the be all end all, but I think this is fine.
Okay. So you think it's okay to leave it like this?
Yeah, it doesn't bother me.
Okay. All right. All right. So the next would be license. The lawful authority to engage in the practice of OT in the state of Louisiana, as evidenced by a certificate duly issued by and under the official seal of the board. We've already voted on that. It's green. Sorry. Just skipped it. Okay. Practice Act. This would be if we kept the definitions, I would move to the practice or official document section. Unless you think it needs to be in regulation, but.
I guess I don't, why do we have to have the definitions separated by types of definitions? Why can't it just be alphabetical order, alpha order of all the definitions, which would just feel simpler?
I mean, we could. I just felt like because some of them are documents or the position statements, and some of them, and I guess this is really a question for Patricia, like at the beginning of the document, when we have that first section, that's I think it's 1903, it's only about the regulation stuff. And it's at the very beginning of the rules. So you have definitions, and it's only under the scope of chapter or the occupational standards. And then it's not until that's in 1903, and then in 49 section, we have the other definitions. So I didn't know technically if it is okay to combine them all because of the way we had it written before.
I'm sorry, did somebody ask me a question, or did I just hear a random question?
No, I was asking you a question because we're talking about the definitions, and in our original rules and regs, we have two separate definitions. The first one is 1903, and it's really just about the professional standards.
Right. And
And
we
then they-
decided, and you all decided you'd rather just merge all the definitions into one place, and that makes perfect sense. And I will tell you honestly that if you read through the law as a body whole, you don't really see them broken out with subtitles as to what kind
Okay.
of definition they are. So you would be fine just to.
That's great news, because I think it'll just be a lot cleaner if it's just alpha order. These are the
Right.
definitions you're gonna
Okay.
find in this
So
document.
I'll go back and alpha order it, but Ingrid, I'm not sure that you want to get rid of all the stuff that we're crossing out in black, because when we give Patricia the two different rules and regs, yours is going to need to be the one of how it was previously. Remember
Okay.
that?
Uh-huh.
So we'll save this as a different document. We'll go back and fix it, and I'll go back and put them in alphabetical order. But when I saw you do that, I was like, one of us needs to keep the original. All right, so NBCOT, we said to take it out, but we do refer to it multiple times in the, and I know we had talked about, like, if the first time we define it, or we spell it out and then put the acronym, because it's really not a definition, but just an acronym.
I think that's why we said we were taking it out of the definitions, because it wasn't a true definition. And we were just within the first time we used it in the document, it would be spelled out. And then after that, it would just be, because we didn't have a definition for it. So that's why we said we were taking it.
So just take it out. Okay, so you can just get rid of the blue then, if we're okay with that. All right, and then OTAC was kind of the same thing of just the acronym. So I guess as long as we know that that's the first time we do the acronym.
Not to swim against the tide, but I think I kind of would leave that, because OTAC is Louisiana specific, and it's not something that the whole world will know. Everybody knows what NBCOT is and all that. So I don't have, even though it's not technically a definition, I don't have a problem with showing what the acronym is in this section.
Okay, yeah, so we'll leave that one. Okay. Okay. Occupational therapist is a person who's licensed to practice occupational therapy as defined in this chapter, and whose license is in good standing. I think that's fine. AOTA, again, it was just the acronym, we refer to it. We think we can take it out because everybody reading this would know what AOTA is.
I would think we could scratch it for that reason.
Okay. All right, and then, all right, so this is the occupational therapy. The green is what we voted on, but if you see the blue, it says revise below. We have to go below because we revised it further to include, I'm drawing a blank here, but I'm gonna get it. It's right on the tip of my tongue. To include physical agent modalities. So we have these two definitions in two different places, but we need to use the one with the physical agent modality. So we can kind of skip that one. Because remember, we went back and added it, because nowhere in the document do we refer to physical agent modalities, but we needed it as a definition. All right, OT assistant. We voted on a person licensed by the board, so that's revised below again because we included to say they cannot do dry needling. Remember that? So that's going to be below. Let's see.
How far below?
Yeah, it's because of the way it's organized. So that's because I had to divide it up because it was craziness. Okay, so there's your physical agent modalities. We already said we were getting rid of person. Physical agent modalities is we've already done. Practice standard we had, I think, on the list, but we don't refer to it in the document. I don't know if we need it in the regulatory section.
I don't think we ought to have the definition if we don't have it in the document.
Right, yeah. Okay, So that's not actually in there. That's just something that me and you put because that was in red. All right. So here's other things that y'all asked us to define. Supervising OT practitioner. And we referred to this with the temporary license. This is to keep in mind, a temporary license, the OTA section has it under volunteer and student. So it's not just with OTAs. And then here's two different definitions. The occupational therapist is ultimately responsible for the implementation of appropriate supervision and is legally and ethically responsible to provide supervision of the OTA student and or volunteer that they agree to supervise. That's how we refer to it in the rules in section 4928. But in section 4903, it's responsible for to the client for OT who observes, directs, consults with, and retains responsibility for service competence and performance of an OT assistant in the administration of occupational therapy to a client. So we kind of need a definition of supervising OTP that's gonna be okay for a temp license, an assistant, a volunteer, and a student. Y'all see the limit here with that definition?
Mhm. Okay. Or do we, did any of the AOTA official documents have a definition for that?
My feeling of when we look through it is that it was always specific to what the document was about. You know, there's a document on OTA supervision, and then there's a separate document about fieldwork and students, and then there's a, you know what I mean? Like, and then there was always something in there about unlicensed professionals. So do we just leave it as defined in each section and not make it a definition? Like, is that easier, or?
Right.
This is kind of defined in each section that it's referring to.
Oh, okay. Well then, yeah, then.
But
maybe.
I mean, like, does that cover everything? Like, I mean, yeah. Let me look up 4928 real quick and make sure. Yeah, so that section is supervision of unlicensed personnel and volunteers. So that's kind of pulled from there. It's not really defined that discreetly. I kind of combined two sections, but it definitely is in there like that. So I don't know that we need a separate definition for it if it's defined in the section that it pertains to. That's my kind of gut.
I would agree, because it feels too, this definition would be meaningless because
right,
combining too many different things. If we've already got it delineated within the section itself, I don't see why we would need a definition.
I agree. All right, so just.
I agree.
Yeah, I don't, you can probably just delete that because that was an addition of us. That's not in our current rules. That's why it's inside that box. The organization of this, y'all, is just, it was a struggle. All right, service company. This is referred to in section 4919. With respect to an occupational therapy assistant, means one who is appropriately trained and qualified to perform occupational therapy in accordance with the current standards of practice as identified by the by the AOTA. So
it feels like it's missing the mark a little bit in the sense that it's also it's site dependent. An OT assistant in a hand therapy clinic has to have service competency and splinting, but in a pediatric clinic might not need to.
Right. So that's the current definition, I think.
Could we simply add in, like, to perform occupational therapy in their current work setting?
With the current standards of practice, for the relevant population and
There
setting.
you go.
I also wonder if there's an AOTA official document that would give us a definition for this one.
And in the beginning, does it read better if it would say means an OTA versus means one? Oh no, it already says with respect to the OTA.
So with the, let's see, I'm sorry, I didn't mean to interrupt. I looked it up, but everywhere we have it, I'm trying to find where in the document it is, because most of where we deleted it. We have the word annual service competency. Okay, so here it's under OT assistant service competency, and it says an OT supervising and OT assistant must have documented service competency on the OT assistant. Service competency assessment is a continuous process which should be completed, blah, blah, blah. Then we have initial service competency documentation, current and annual. So it's all in relation to the assistant.
Would the term for the definition not then be service competency assessment?
Well, you have like an initial one, it just says we must have documented service competency. So it's not really just the assessment, right? Because we say that it's the ongoing, and it's designed to document the OT assistant's ongoing skill set.
I'm gonna add the AOTA's definition at the beginning and see if that makes more sense after we do that.
All right.
So AOTA defines it as the ability to provide OT services in a safe and effective manner, which is a nice generic thing. Then we could go on to say, with respect to an OTA, it means one who is appropriately trained and qualified to perform OT in accordance with the current standards of practice for the relevant population and setting.
I like it.
I like that.
Okay.
And when you read it, Ingrid, and you said that made it make more sense, at least in my head. Mm-hmm. So with respect to occupational therapy assistant, it means one who, or this means one.
Yeah.
Oh, I don't understand that spacing. Oh well.
It's okay. I'll fix it later. Just get it in there. It's because it's in a table. It's all of this is just, yeah. All right, so are you making that green?
I was gonna make it blue until we vote on it, right?
Okay, perfect. Okay. Unprofessional conduct is means, acts, or behavior that fail to meet the, okay, so that's just the Google definition. The AOTA Model Practice Act takes it into like this weird rabbit hole of like taking action against it. So just to define unprofessional conduct is just, I felt like we needed a basic definition that was like the act or behavior that fails to meet the minimally acceptable standard expected of similarly situated professionals, including, but not limited to, conduct that may be harmful to the health, safety, and welfare of the public, conduct that may reflect negativity on one's fitness to practice, or conduct that may violate or any provision of the code of ethics adopted by the board or specialty. I think we could like take out the specialty part. I think we could kind of beef it up to just be a little bit more. I mean, that the AOTA Model OT Practice Act is not really a definition.
Yeah, the big thing is that it references the AOCA Code of Ethics.
But we can put that in the first one, you know, any provision of the AOTA Code of Ethics. Yeah. And instead of professional, should we put practitioners?
Of occupational therapy practitioners.
Yeah. Not that much. Yeah. Yeah. And then somewhere instead of, okay, so safety and welfare of the consumer, not the public, right? Because it would be specific to our client.
Would it be consumer or client?
I think it
I
might
feel
be
like we don't use
client.
consumer anywhere else.
Yeah, it would be client. Because we define that too as.
That was my thinking.
Yeah. Okay.
Did I say most current AOTA Code of Ethics?
Sure. Okay. So the stuff underneath, could you just delete it? Thank you. It's a lot. You can get rid of the DP Google too. That just tells you where I got the definition. Okay. So I know we don't have too much more time, right? Am I right? Say it again.
13 minutes.
Yeah, okay. It's just my computer time didn't update, so that's like on New Orleans time, but my phone isn't. I'm like so confused today. So I just wanted to ask. All right, so just quickly, the next section is all the official documents. And it's like says what they basically are. And I guess like a question would be, do you put the source? Like, do we put the link? Like, is that something that would be appropriate? I mean, that somebody could like literally like just pull up the document? Or is that like a Patricia question?
I don't see links within rules to other documents. References, yes. Actual links, I don't usually see that.
Yeah, that's going to be a mess because when the links change, I don't think we ought to go there. Somebody can find it themselves if they want it.
Okay.
I would actually just say with this one, we have to call this the American Occupational Therapy Association Code of Ethics. We have to be specific.
Well, sometimes under the like in the rules, like at the end, like under the authority note or historical note is where like they put the I guess, the reference. Is that right, Patricia? Or do we just leave it like this and then you'll put it where it's supposed to go?
No, the reference that you see in the bottom is the reference to the enabling statute that allows us to make the rule.
Oh, okay. Never mind. All right. So I guess in the lieu of time, we'll just stop here.
You want to go back and vote on the ones we talked about?
Yeah. I think so.
I think, so that would be application, approved course, board, OTAC, service competency, and unprofessional conduct.
Okay. All right. I'll make a motion to approve the definitions that we edited today as written.
I'll second it.
All in favor, please say aye.
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 Anyone oppose or abstain? Okay, so I guess my question is, how do you want to move forward with this? Do you want me to go back and put it in ABC order and then we can keep in green what we know we've already done? Kind of make it easier?
Mm-hmm. Yeah, sounds like a good plan.
Oh, wait, we did compact privilege too.
Yep.
Okay. All right, so with that in mind, I'll keep doing that. Then the next section we have is temporary license. Do we remember what the issue was there or why we needed to review that? Because I think there was some confusion with Dr. Van, right? With like, was it?
It was because when we got to the part about foreign trained, and we significantly changed. Yeah, we definitely needed to go back and look at that and review it. So, I'll go back and sort of look at it and see what I can find from the minutes to remind everybody and send it out like to everybody to review before the next meeting, so that we come with ideas on that.
Okay. Good. All right.
I believe one of the issues was the use of the language license. I think.
Yeah.
Yeah.
Versus a temporary permit.
Mm-hmm. Yeah. Right.
Mm-hmm.
I think actually in that definition, we yeah, I think I put that in because that was one of the things that was on the list to define, and I was like, okay, is it a license? Is it a permit? Like what? Because there was some confusion.
Yeah, it's a permit. We don't issue temporary licenses.
Okay, is it a temporary permit or a limited permit?
All permits are in essence temporary. We can revoke them at any moment.
Okay, so we refer to it as a temporary permit, correct?
You can, it's fine with us.
I think that was part of the issue with that whole section.
Okay, that makes sense. Okay, yeah. Let's see, I'm going back to the agenda and the notes. And okay, so after we do that, and I'm sorry that I didn't do a formal introduction for Kathleen and Mary Greenkeys. It was on the list and it got put on the back burner with the coaches stuff. So I apologize to y'all. I know we voted on them, but Kathleen is an OT assistant. with 6 years of experience in, I believe from her resume, she practices in home health in Monroe. Is that correct, Kathleen? You still with us?
Yes, well, now I was in home health for almost 6 years, but now I'm in rehab at the hospital.
Awesome. Okay, well, welcome. I'm sorry.
Yes, welcome,
Thank you.
Kathleen.
And then we have Mary Green Keys, who's an OT in New Orleans with 22 years of experience, and she's at the Veterans Healthcare System and has a role in management. Is that correct? Do you want to add anything, Mary?
No, I actually have 29 years of experience.
Sorry.
And that's okay. That's okay. And it's a pleasure to be here.
Well, we welcome you. And I'm sorry you kind of got thrown in, but as all of us unfortunately can say, our first meeting was like an eye-opening, like, okay, what did I get myself into experience? Before we talk about the December meeting, I did have a question for Dr. Van, because I wasn't able to get clarification on this. The next meeting that we have, do we need to, what is the procedure in your mind for chairs and co-chairs of OTAC?
In regards to what?
Like, from what I understand, I received a phone call from the past chair to ask to be chair, and then I asked Ingrid to be co-chair, and that's how that went out. I don't know if that was the correct.
We don't get into determination of how you'd make your chair selection or your vice chair selection. You all are free to do whatever you want. There's nothing, y'all make your governance. We support you all in every way we can.
Okay, great. I just wanted to make sure there was nothing official that we needed to do.
No.
So, if anyone's interested in being co-chairs with Ingrid, please let us know. She's agreed to be co-chair again. And I think we'll turn to the format of 2 co-chairs. Not that it's really that much of a difference, but yeah, so.
Yes, please join me. I need somebody else. I definitely cannot do it alone. So
yeah, Kelly said she's thinking about it, but anyone else who's interested, then just get in touch with us, but we'll do that. And then, so we had a December 1st meeting on the calendar from the last meeting. However, it was brought to our attention that Dr. Van and Olivia and them have a conflict, but we are able to have the meeting at 1. It looked like everyone was pretty able and willing that we would have a quorum. I think one person said they'd have to join at 1:30, so that we can hopefully get through the rest of the definitions and possibly onto the temporary license. But I just feel like if we could do one more meeting and get through these definitions, it would be a huge chunk. But I'm going to leave it up to the committee to see if that's something y'all just want to tackle next year. And then I know we've had a lot of questions about dates for next year, but I don't know how we want to go about that.
Well, again, my suggestion to you all is to pick dates as far enough in advance as you can, because it allows your members to look at their schedules and clear their schedules for conflicts. But again, I'm sorry about we already have another advisory committee meeting that morning, and we just can't run 2 at the same time.
Yeah, and I think we can go to 1. We can start at 1, and that's fine. But so we'll establish that the next meeting will be on the 1st at 1. And then as far as the meeting dates for next year, like, I guess it's up to y'all to decide. Do you want to go back to quarterly? Do you think we need more than that? Like, does it depend on how far we get next meeting? I don't know what y'all's thoughts are on that. I don't want to make that decision because I won't be part of it, unfortunately, or fortunately, however.
I feel like we have to keep with monthly until we get these rules turned in.
Did somebody else want to say something?
Yeah, this is Raylina. I was just saying I came on right as we started this, so I don't know anything other than monthly, other than doing the revisions. Like, other what else is discussed usually? Is it just incidental things that come in from OTs across the state? Like, how often is it normally outside of the rule revision?
So when Brenda and I started, it was quarterly meetings. So there was 4 meetings a year, but part of that was because they had to take place in New Orleans and they didn't have an end time. So that was the other thing. Like, some people always said they had to leave because they had patients, but the people who drove in from like Shreveport, like, we could literally start at 8 in the morning and not finish till 5 or 6 at night. So that's history. Now that we can meet like this, it changes everything. Technically, once the rules and regs are done and we turn them over to Patricia, you will have like a lull of only the things that come up for executive session, or if you have an email from something that you'll have to deal with, things like that. Until then, Patricia and them come up with a draft, and then y'all are going to have to make any changes to those drafts, and then it's going to go into that whole process with going to the public and things like that. So I feel like there may be a few months if you have to finish that you might need to go monthly, but then after that you can switch. That's why it's like kind of hard to make the schedule. But like Dr. Van said, it's probably a lot easier to make the schedule and plan for it and then cancel it if you don't need it, versus only scheduling a few meetings but needing more.
Yeah, and I would say this too about when we were only doing quarterly is we really were not responding to therapist questions and concerns in a timely enough manner.
Right. Because you had to wait.
Yeah, I really think quarterly was not frequent enough, no matter what.
Yeah, but we didn't get many historically.
I
Now we
know.
are.
Yeah, but I mean, monthly might be more often than we need once we're done with the rules and regs, but quarterly, I feel like is not responsive enough to the OT practitioners.
Yeah. So that's why Mary and Kathleen, when y'all asked how often do we meet, my answer was very ambiguous. Like, well, depends. Okay. So do we just want to put on the agenda for December to come up with those meeting dates, or do y'all want to do it now?
I think we do 1 o'clock.
Don't we need to get dates from Dr. Van, what his availability for next year?
I think we ought to start with that too.
Okay.
Yeah. I think I'll write to I'll collaborate with Dr. Van on his schedule for 2024, and then maybe we'll come to the next meeting with possible dates in hand for people to look at.
Ingrid and I can put together for Fridays that you like. Seems Friday's available to y'all, and we'll set it up and we'll tell you which ones are available, and y'all can make a decision when we meet in December.
Yeah, if y'all want to continue Fridays.
Okay.
And Dr. Van, just a quick question. Are you aware of if the applicants who applied who were not selected to the committee, were they informed yet? Or is that something I should do? Y'all do?
To the best of my knowledge, they were informed.
They were informed?
Yes.
Okay. That's
and also it's been a public meeting. It was decided at a public meeting of 2 bodies. And we did, it's my understanding, we sent the letter to the people who were not selected.
Okay, I'll follow up just because one of them that asked me, had we decided yet? And it was someone who applied.
Well, again, I'm sorry. I was told that we sent the letter. I don't know.
I just wanted to make sure it wasn't supposed to be on my agenda.
No.
Okay. Okay. Do we have any other further public comment? Do we have any comments in general?
I was just going to say, I like the idea of meeting monthly until we finish the rules. And then I don't think we need to do monthly, but I do think timely is important. If somebody's got to waiting to see if they're able to get a license, you'd hate for them to not be able to work for months because they're waiting for us. So I'm kind of on the fence of that issue.
Yeah.
And let me say this to you. You get on the schedule, you first come, first serve when it comes to my time. If I commit to you all first, I'm gonna commit to you all first. Believe me.
Thank you. Okay, Dr. Van, can you please check to see if there's any public comment before we end the meeting?
And there are no public comments at this time, ma'am.
Okay, does anyone else have any questions, comments, concerns? Otherwise, we will adjourn this meeting at 1:04. And thank you all for your patience on all of these issues and continued work. Hopefully we'll seal it in December. I'll work on it and get copies out to y'all so that y'all can look at it and be a little bit more familiar with it, and so that it's not just 1 or 2 days before the meeting. But yeah, okay, and have a great Thanksgiving.
I have a quick question.
Yes, ma'am.
We will get the oath via DocuSign today, correct?
Dr.
Or-
Van, Patricia?
I'm sorry, I was told it would be sent to you today to the email
Okay.
addresses that you gave. I'll make sure that I reinforce that with Miss Olivia before the end of the day.
Thank you.